I mean, we work with some practices that, bring in $500,000 in revenue. I mean, there's some of our clients that bring in over $5 million in revenue. And, I've got some, sort of opinions on like what I think differentiates these two types of practices, but I just want to hear from you, from your experience, like what's kind of the differentiators between a practice that brings in 500K and one that might bring in 5 or 10 times as much revenue?
I think a lot of those larger practices that are very successful, they come down to leadership. And the principal dentist or the principal dentist, if there's more than one, they're just great people to work for. They always show up with that positive attitude. They're great at recruiting, rewarding, and retaining excellent staff. One of the key things we've seen that causes dental practices to struggle is culture and staff turnover. Patients pick up on that. They are aware that, oh, they got another new receptionist there. I don't even know this person. I can't remember her name, or there's a different dental assistant every time I go there. Some of these practices have a number of associates working in them, but some of these practices don't have great leadership and they have associate turnover. They come in, they work there for a bit, and they go, I don't like it here. I got another job someplace else. So culture, leadership, and preventing employee turnover, I think, is critical. And I think it's Steve Jobs that said the customer is not number one. Your employee is number one, because your employee will help you look after the customer. And that quote goes around the internet and LinkedIn and Facebook quite often. And I happen to believe that's true. And what we try to do at our company is to focus on culture and morale. And sometimes it's high, sometimes it gets low. And quite often the analysis will show that there's one toxic employee that's dragging that whole place into negativity because they're just having a bad time in life, or a bad time with, family or marital situations, whatever it is. I get that. Sometimes people have a tough time in life, but they can't bring it to the office. You got to park that at the door, folks, every single team member, and you have to walk in with a bright, sunny smile, and you have to give that patient an exceptional experience. And it's not about the dentistry at that point. That's about a place where people like to go, they get their treatment, and they go tell their friends and family and colleagues about it. And those are the exceptional practices. Great leadership.
Yeah, I absolutely agree with that. I think a lot of dentists are looking for like automation. They're looking for some way to just manage people, manage their patients, on autopilot, and then they just come in and do dentistry. And they don't understand that, no, you have to wear the business owner hat. And, I get that a lot of dentists are very technical people. I mean, they like working with their hands. They like the sciences, they're not necessarily built for leadership. And I fell into the same trap as well as a, technical person. But there is a lot of value to learning and improving some of those skill sets, because at the end of the day, it's your business. You have to lead it. You have to be the leader. I mean, people will look up to you. And yeah, if the morale isn't great because, your leadership sucks, the practice is going to suffer.
I own a small personnel agency that does some temping and some full-time employee recruiting. And our model is very simple. Great staff, great day.